It's early March in Shanghai, and the children's hospital is packed with patients who are suffering from what the government and hospitals call Influenza A. Because of this infectious disease, many children have high fevers and diarrhea today. It seems that not only in Shanghai, but also in Zhejiang some while ago. It's very serious. The child next door to me also has a fever, and the parents were informed to take the child back to rest at home. These days, they can't go to school. Official authorities say it isn't the new coronavirus, but we, the people, are privately discussing that it might be related to vaccination because children have basically been vaccinated. It can be said that the so-called Influenza A has broken out on a large scale before the COVID-19 epidemic in China receded. According to data from the Chinese Center for Disease Control and Prevention, CDC, on March 11th, the number of Influenza A patients nationwide grew by 60 times in 28 days. That is, in the 28 days from February 5th to March 5th, the positive rate of influenza virus jumped from 0.7% to 41.6%, a nearly 60-fold increase. The Chinese media said that the H1N1 influenza virus is now rampant in the population. Due to the non-transparent information of the authorities' data, the outside world cannot be informed of the real situation. Many Chinese netizens have posted videos saying that the symptoms are very much like the new coronavirus. But it's even more unpleasant because it starts very quickly and fevers can easily climb up to 39 to 40 degrees Celsius, or 102.2 to 104 degrees Fahrenheit.
The symptom is more uncomfortable than the previous positive case of COVID-19, with repeated high fever, body aches and pains, and coughing all the time. The temperature just won't go down. Now there are especially many children with this flu in the hospital. Yesterday at 1 p.m., I went to 2 hospitals and couldn't get a number. Another children's hospital can only be registered as an emergency, and the ER front actually has a queue of more than 300 numbers. According to the doctor, it's just the beginning, and the hospital is out of stock of the special medicine for the treatment of Influenza A.
A netizen in Jiangsu province wrote in a March 6 post that her child's symptoms were worse than the new coronavirus with repeated high fevers. The special medicine for treating influenza A didn't help this time. The child vomited after taking it and also had nosebleeds from time to time. He was in pain all over his body. It was so painful that he cried. The most pain is in the head and chest. He has been in bed for 5 days and can't get out of bed. During the period of the new coronavirus, the child could still get out of bed and play for a bit. Many people have questioned whether this wave of fierce influenza A is a variant of the new strain. The Chinese government claims that the symptoms of influenza A are similar to those of the new strain, such as fever and body aches. Officials also claim that influenza A is mixed with the norovirus and causes diarrhea, which is also a typical symptom of the XBB variant. This influenza A, I found it to be like the new coronavirus more and more because its symptoms are basically identical. It's basically an advanced copycat one-to-one. Influenza A also has after effects. I would like to ask this expert, that professor, what's exactly the relationship between this new coronavirus and influenza A? The Beijing Municipal Education Commission issued an influenza prevention tip on March 8th, reminding schools and nursery institutions to do a good job of health monitoring in crowded places, and that patients with respiratory infections do not bring the disease to school and avoid infecting others and spreading the disease. This is a recording of a phone call made by the staff on duty at Beijing Children's Hospital.
If you want to see a doctor, bring your child to the hospital and register on site. Yes, there are many people. Recently, we have a lot of children who have fevers and cold symptoms. As for how long the wait is, you can see for yourself the number of people on site.
Aren't two sessions taking place right now? So there aren't many transient people in town. I've heard on the internet that influenza A is very serious, influenza A in Beijing. I haven't seen any children around me having it, but there are quite a lot of adults who have colds. They can't breathe through their noses, their throats are uncomfortable, and they have fevers like 39 degrees Celsius or 102.2 degrees Fahrenheit. I have a friend with a fever. It's probably contagious, so he told his parents that he wouldn't go back home. In mid-March, the citywide Sentinel hospitals in Shenzhen, a city in southern China, reported an increase in flu cases over a period of a week. According to the results of comprehensive disease risk forecasting in Shenzhen, the current risk level of influenza in Shenzhen is medium. That is to say, the flu situation in Shenzhen has risen to medium risk. Shenzhen announced that the city had entered the active period of influenza, requiring schools, child care facilities, elderly care institutions, and other units to do a good job in prevention and control to reduce the risk of cluster outbreaks as much as possible. With the exception of Shenzhen, the number of people seeking treatment at fever clinics and hospitals across China has been rising rapidly, leaving the medical system overloaded. The Tianjin Children's Hospital has had long lines every day for days, and cars have been lined up for a long time trying to get inside the hospital. People have posted on the internet that it has been like this for several days. The Children's Hospital in Zhejiang Province was full, with 4,000 people attending in one day, and the waiting lobby was packed with children and parents. This was a hospital in Liaoning Province, northeast China, on March 11th. The video shows that even the hallway is full of beds. This is a hospital in Changchun City, northeast China. It got so busy that it stopped registering at 8:30 a.m. In Shijiazhuang City, Hebei Province, the number of patients with fever is so high that they are making beds on the floor to wait for their turn. A well-known Chinese actor revealed on Weibo at the end of last year that he was infected with COVID-19. At that time, he posted his test results and said with disappointment, "I can't remember what day it is, or are there 2 bars? The sunset is beautiful, and I am very depressed." On March 13th, 2023, he posted the results of his influenza A test on Weibo. He said, "It is confirmed that I am infected with influenza A. My friends say that I am very fashionable. This wave has caught me too. It seems that I am deeply loved by viruses." The Chinese website NetEase stated on March 12th that the highest daily increase in fever patients in hospitals across the country was as high as 481,000. And it continued to rise. There are still many fever patients who haven't gone to the hospital for treatment, and the real number of fever patients may be even higher.
My child got infected and came back from kindergarten at 10 a.m. with a temperature of 39.5 Celsius or 103.1 Fahrenheit. It's horrible and feels so bad. I couldn't stand it anymore, so we went to the hospital. The doctor took a look at the throat and confirmed that it was influenza A. A family of 3 is infected with influenza A and goes to get the injection together. Early in the morning, I gave the notice of absence to the classes of my 2 children. My son's class has 15 students absent today. His sister's class has 10 students absent. At 11 a.m., we went to get an injection and found out that there were lots of people at the clinic at this time. Look, there are many IV bottles on the table. They should be the ones that haven't been put away yet.
When I went to the hospital, I saw many children with similar symptoms. After receiving the antigen test report, they were finally diagnosed with influenza A, which was weakly positive. If you have children at home, pay attention. We are out of stock of the drug oseltamivir. The communist government, the media, and official medical experts have uniformly called the surge Influenza A. For example, on March 13th, a doctor and official at a hospital affiliated with a well-known medical research institute in Beijing told the media that about 70 to 80% of those who are currently experiencing related symptoms are influenza patients. This official also described that the symptoms of COVID-19 and influenza A are similar after infection, such as fever and cough. Secondly, both viruses are mainly transmitted through respiratory droplets, and both can cause pneumonia and have similar imaging manifestations. How do you determine if someone is infected with influenza A or COVID-19? This official claimed that a fever patient who has recently been infected with COVID-19 is more likely to be infected with influenza A. But he added, however, the primary way to confirm which is which is through nucleic acid or antigen testing for influenza and COVID-19. According to an epidemiologist at the CDC, people who have been infected with COVID-19 aren't protected against influenza. If symptoms such as runny nose, fever, and headache occur, they may turn into pneumonia or a serious illness if not treated in time. Many Chinese doctors are quite vague about this. They appear to be sticking to the official name of influenza A, but also seem to hint at the special and subtle relationship between influenza A and the new coronavirus. Persistent symptoms of COVID-19 shouldn't be neglected. Today, we saw more than 100 patients in the clinic, and nearly 70 of them came in with symptoms following recovery from being positive for COVID-19. The most common symptom is still coughing, mostly caused by itching in the throat or lower trachea. The next most common symptoms are chest discomfort, weakness, and cold sweats. Some of these have their own respiratory problems, while others have no obvious respiratory symptoms before the infection. Of course, there are also those who have obvious anxiety-induced symptoms that I won't mention. Most of these patients had no obvious manifestation of COVID-19 infection in the lungs. That is, COVID-19 infection was confined to the upper respiratory tract, mostly in young people, and the proportion of older people with traces of COVID-19 virus in the lungs is significantly higher, with the age limit being around 40 years old. In other words, although people over 40 years old don't necessarily show signs of severe pneumonia, the proportion of patients with COVID-19 pneumonia is significantly higher and will leave certain fibrotic scars at a later stage. These fibrous areas may not necessarily affect lung function or cause symptoms. However, fibrosis may not be completely cleared up either. The peak of the epidemic has passed, but the effects of COVID-19 infection are still present. Whether these symptoms are a short-term or long-term phenomenon remains to be seen. According to the pattern of past epidemics, influenza A may last for another month or so before it ends. However, this duration may change as our immunity decreases due to the spread of COVID-19. Finally, we are reminded that influenza A is not like the common cold. It is a virus that can cause serious complications such as myocarditis, white lung, and so on. The end of March is a critical time. Besides influenza A, will the COVID-19 virus come back? We aren't too optimistic at the moment, as about 80% of the human body still has a high level of coronavirus antibodies. But by the end of March, this level of antibodies has lasted for 4 months, and there is a risk of reinfection once there is a new coronavirus present. During the CCP's 2 sessions, a Shanghai medical expert, also a member of the Chinese People's Political Consultative Conference, admitted in an interview that the next wave of the epidemic may be coming. He said that since the virus has been downgraded to Category B, it will be grouped into fever clinics. Recently, in Zhejiang, Henan, Xi'an, Qingdao, and many other places, influenza A patients with big white lungs have been discovered with even some fatal cases. For example, the Weibo page of Zhejiang Daily reported that an 8-year-old boy in Hangzhou was infected with influenza A. He had been feverish for a day before he sought medical attention and was sent to the hospital for an emergency CT scan. It was found that much of his lung had turned white. All of this adds to the suspicion among the public and the outside world that what is going around is probably still COVID-19. A year ago, Xi'an City was completely locked down due to the outbreak of COVID-19. People still have lingering fears when talking about this incident. On March 8th, the Xi'an municipal government issued the Xi'an City Influenza Pandemic Emergency Plan. According to the plan, based on the scope and harm of new or new subtype influenza virus strains or the reappearance of old subtype strains, in the second-level stage of the emergency response, it is proposed to take temporary social control measures in a timely manner. When necessary, suspend work, business, market, and classes in outbreak and epidemic areas. Restrict or stop the use of relevant public places. Restrict or prohibit crowd gathering activities and production and business activities that may cause the expansion of epidemics. The Level 1 response proposes measures such as blockade of epidemic areas, traffic quarantine, suspension of production, and suspension of business to be implemented. The above-mentioned emergency plan for influenza in Xi'an drew the attention of netizens and attracted much discussion. Is it that serious? Is it the flu or COVID-19?
It seems that this influenza A outbreak is at its peak in many places, and there is a suspicion that influenza A may be the original new coronavirus. Only the Communist Party has changed its name, and that's what happened. The government issued this document, so there must be an outbreak in one of the districts of Xi'an. Currently, wherever there is an outbreak, the government tries to cover it up. You aren't allowed to tell the outside world.
Many schools in Hangzhou, Beijing, Shanghai, Tianjin, Zhejiang Province, and other places have taken measures to suspend classes because of a concentration of fever among students. It's the first time I've heard that classes are suspended due to influenza A. Shanghai, Ningbo, and Tianjin all have classes suspended due to influenza A. We have a few colleagues here whose children go to kindergarten. Usually there are more than 20 children in a class, and these days they are only half the size. Staff at the Shanghai metro station disclosed that they received an internal document from the station manager on February 21st of this year, titled Handling Procedures for Positive Passengers. The document demands proper epidemic prevention and response to the second wave of the outbreak.
Yesterday, a kindergarten and a primary school in Donghu High-Tech Zone announced the suspension of classes, respectively. The parents' group on WeChat instantly exploded. One of the third-grade classes has 14 students who don't feel well and 8 students with a fever. The number of infections has been increasing.
Some parents also revealed that their children, who weren't positive before, became positive this time. Some hospitals, during the epidemic of COVID-19, implemented a measure to allow only one companion for a patient, which is being implemented again.
This is the second hospital of the University of Medicine. One patient is only allowed one family member as a companion, and additional companions are prohibited. The patient is in the hospital, but we can't send him anything, even if we want to. The attitude of the security guards is terrible. The epidemic has ended, but the rule is still one patient, one companion.